Hello everybody, and I welcome you to my journey from care to prevention. So when we think about here in the Western industrialized civilization about an illness, then we think we go to a doctor and then we expect that he give us a pill and then everything should be okay. But in future, this would be not the way we can go on. So we need more prevention. On the one hand side, to avoid illnesses and avoid diseases, and on the other hand, when we have diseases, to avoid further diseases. But let's start with the past. So we go one step back to the past. So when we go to the past, then you see on the left-hand side the Egyptians. Though they were praying to God and say, please God, help me that I am not fall into disease and I do not suffer from a disease. So this was the very early beginning of doing something with health. And also the Greeks one and the Romans pray to gods, but they also start thinking about the body. And so they're thinking about health. Then the next period would be the Renaissance, where we had the pest, and where we had many things to think about, and so they started to care about deaf people, what is inside our body. They opened the bodies and see, okay, now we know how our body is working and functioning. So then in the later on, then for example, the Canadian scientists Frederick Banting and Charles Best discovered insulin. So it was in 1922, so it was now on the fourth step, and which helps the body manage the level of sugar in the bloodstream and controls diabetes. And also in the September 28th of 1928, Alexander Fleming discovered the penicillin, a mold byproduct to cure bacterial infections. And then later on, July the 1st, 1946, the Center of Disease Control and Prevention was founded. So there are much more steps than in the newer history. But let's go to the next thing we have to talk today is the cultural. So cultural conceptions of diseases. So different cultures can have vastly different ways of thinking about diseases. For example, some diseases are expected as a normal part of development. So, for example, chickenpox. But whereas others are unexpected. So, for example, shingles. And some diseases are culturally stigmatized. For example, lung cancer. Whereas others are culturally supported. For example, breast cancer, especially here in Germany. In India, for example, white pills are considered mild and safe, whereas black pills are considered powerful and dangerous, which can affect patient compliance. And this is something also in the past the British emperors had learned when they were in India. So in the late 1890s, religion was among the major factors blamed for the spread of plague in India. So many Indians hid black patients at home and refused to cooperate with authorities out of anger against the anti-black measures that clashed with their religious and cultural beliefs. But also in the east-west side, we have in Europe here, we have a big health gap. So one of the biggest challenges facing Europe is the East-West health gap. And historically, the transition from infectious to chronic diseases came first in Western Europe before occurring in Eastern Europe. However, after World War II, it went much more smoothly in the former socialistic economy countries. A quicker increase in life expectancy in the East, for example in Poland, life expectancy at birth increased, led to an equalization of the health differences between Eastern and Western Europe during the early 1960s. However, it seems that the most important reasons are dietary changes resulting from the introduction of a market economy and changes in prices of various food items. So the most significant factor could be increased consumption of polyunsaturated fatty acids, such as alpha-linolenic acid. The health improvement in Central Europe is just beginning, and we still have a long way to close the gap. And the dramatic natural experiments that are taking place in this region are pertinent to the entire continent. And the key role of the European public health specialists should be explaining them and initiating intervention in these fields. So, when we have a look on the overall mortality rates, they vary widely across countries. For example, here in 2015, France, Spain, and Italy have the lowest death rates, with age-standardized rates between 850 and 900 deaths. So when we see Germany, it's after the European average. So this was mainly due to the relatively low mortality rates from circulatory diseases. Mortality rates are highest in Bulgaria, Romania, and Hungary, with age-standardized rates at least 50% higher than the EU average in 2015. And the main reason for this much higher mortality rate is higher mortality rates from circulatory diseases. So in Hungary, higher mortality rates from cancer explain a large part of the difference with the EU average. So this was more a few back and some statistics, but now we want to talk what can we do with the prevention and what can help us here. And one part which can help us is the digital health, and here precisely the artificial intelligence. So, first of all, I want to talk AI in wearables. So AI-enabled wearables show much promise in fall prevention for the elderly, for example. Accelerometer bracelets or smart belts combined with an AI algorithm allow the accurate prediction of all events pre- and post-impact. This application has the potential to help save 1,800 lives a year and decrease fall-related costs by as much as 3.8 billion euros. AI applications in cardiology are also skyrocketing, especially in the diagnosis of cardiovascular diseases, such as heart failure, for example. Atrial fibrillation and cardiac arrhythmias, important indicators of heart failure, can now be detected by a combination of smart watches with electrocardiograms and AI algorithms. This has the potential to significantly reduce hospitalizations and save up to 36.9 billion euros. And also the last example would be the diabetes treatment, which will also be quite significantly impacted by AI in the next 10 years. So AI-enabled continuous glucose monitoring, wearable devices that track blood sugar levels day and night can predict highs and lows and provide tailored health advice to patients. But the next step would be then the personalized apps, and in combination with AI, and this could play a significant role in improving health outcomes, quality and care. This can be reflected in a potentially significant number of lives saved per year. The largest potential lies in metabolism pathologies such as obesity. Treatment can be improved with an AI-enabled personalized app that provides intensive ad hoc behavioral counseling to help change health-related behavior. AI-powered personalized apps can also be used in care provision. For example, nurse applications can improve treatment for chronic diseases via a virtual nurse assistant for personalized monitoring and follow-up care. The patient is guided by an avatar through the treatment process and receiving instant feedback. The app monitors health conditions, keeps track of doctor appointments, and predicts follow-up treatments. So, artificial intelligence is also distinguished by its analysis capabilities and its deep learning algorithms. And these capabilities can be deployed to traverse massive amounts of data and detect a few variables across hundreds of thousands of data points that are specific to certain conditions and diseases. In context of broad learning, artificial intelligence holds the potential to aid in the diagnostic process and identify problems before they become serious. So, for example, researchers from Sutter Health and the Georgia Institute of Technologies are using deep learning to analyze electronic health records to predict heart failure before it happens. Initial results have empirically demonstrated that this artificial intelligence can accurately predict heart failure 1 to 2 years early. So, and what is also important is here the healthcare quality and the move of artificial intelligence to preventive healthcare. So we on our research group, we are also talking about not only the artificial intelligence, but we are also caring about the impact of the artificial intelligence. And there we are in combination with another university, we are doing a PhD together, and the aim is in 3 steps. So what are users' requirements that allow individuals towards effective behavioral health? The second step would be how will artificial intelligence application leads to individualized and precise monitoring of post-COVID-19 short-term complications. And the last step we want to have a look on it is how to gauge users' behavior towards individualized algorithm with eye tracking. But not only the artificial intelligence is important, but in the next step we're also very important or very interested in good sensors, because we all know the words garbage in, garbage out. So if we have garbage data, then the best artificial intelligence algorithm can do nothing, because we have then a garbage. So therefore, we are currently in a project in which we are using artificial intelligence algorithms in combination with AR glasses to investigate and implement information about the physiological condition of the insured persons based on biosensors, inclusive pre-existing conditions, and a rapid targeted assistance under the guidance of specialist personnel. So for telemedical care in rural areas by using 5G. In terms of digital patient records, this can be accessed to historical as well as current physiological data measured by biosensors such as blood pressure, temperature, humidity, or sweat measurement. And when the rescue worker arrives, this can be the live transmission, including the aforementioned data to the medical personnel, and under their guidance, the initiation of targeted assistance measures or the performance of diagnostic. And this triage is quite possible. So in the next step, or also with that, we want to do wound monitoring. So wounds are a major health concern and are susceptible to infection, thus are considered the leading cause of non-traumatic limb amputations worldwide. So the wound environment is dynamic, but the healing rate can be enhanced by administration of therapies at the right time. Smart and automated flexible wound dressing with temperature and pH sensors are integrated onto flexible bandages to monitor wound status in real time. To release the drugs on demand, the smart bandage can be also equipped with a microcontroller to process the data measured by the sensor and to program the drug release protocol for individualized treatment. In the next, I want to talk about sustainable prevention. So, system medicine will make it possible for us to provide effective and sustainable prevention, and digitalization makes it possible. So, the central resources of current scientific work are interdisciplinary studies and the resulting biomaterial databases that deliver fast, reliable, and comprehensive results. In addition to previously determined health-relevant data, additional data will be gathered with a focus on family, social, and environmental aspects. And this includes lifestyle, job history, personality, traits, social and financial situation, living conditions, and also exposure to noise or fine dust. Yeah, and this is then my last comment here. We need a shift of the point of care to where it's needed. Thank you very much.